Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
Midwives are crazy. If you had told me before I worked here that they really, really care, I'd say, well, it's a company line, but they really, really care. I see midwives stay 2-3 hours past that time, just to make sure that person that they've been with all day has a successful birth, and then they go and visit them up in the Lily Suite, and you know, it really is a genuine attachment. I wouldn't have believed.
Arriving into the day assessment unit at 34 weeks pregnant is athlete Mary Cullen. It's the first baby for her and her partner Mark. The relationship first blossomed more than 20 years ago.
I think we were buddies first, weren't we? We were friends, and then we kind of developed more.
Yeah, I think the feelings were probably stronger on my part at the beginning. Mark might disagree, but I think, probably maybe when we were 16, 17, I really liked him. And yeah, I think I did kind of think I'd spend the rest of my life with him, which sounds a bit mad.
Both of us were runners and kind of moved along with each other through running and went to America together with running.
I went to championships like the European Championships, World Championships, and I won a European bronze medal in 2009 and broke one of Sonia O'Sullivan's Irish records for indoors. So I still have that record at the moment, but hopefully there'll be an upcoming junior that will take it off me. So I'm 34 plus weeks pregnant, and I'm in today to get steroid injections to help the baby's lungs because I'm being induced this Sunday. There's a lot of emotions going on. There's excitement to meet the little one, and there's also a little bit of apprehension just that everything will be okay.
Mary was diagnosed with a rare form of cancer when she was 8 weeks pregnant. She underwent surgery at Beaumont Hospital, but needs to start radiation treatment as soon as possible, so her baby is being delivered 5 weeks early.
I love that sound. It started off, I guess, July of 2018, where I had this like fullness in my ear and just like deafness as well that just didn't feel quite right. Went to my GP, who did notice I did have a swollen lymph node at the back of my ear. I went into my local hospital and they did a biopsy on the lymph node. That's then when they kind of knew that it wasn't good news and that it was potentially a carcinoma of some sort. The tumour that they were seeing when they went up my nose with the camera was just the tip of the iceberg. The actual tumour itself was further back in that nasopharyngeal space. So thankfully he was able to debunk part of it, but part of it had to remain there because they obviously couldn't remove it with the surgery that was, I don't even know if you could have had surgery to actually remove the last part because it's so far down, close to my brainstem.
1, 2, 3. Well done.
Balancing the competing risks between the health of the baby and the health of the mother in a cancer case is always very challenging. In this particular situation, her tumour seems to be slow growing, but it is still a malignant tumour, and therefore there is still ongoing risk of spread of the tumour every week that we defer and we wait. So it is therefore difficult to justify keeping a patient like this pregnant beyond 34 to 35 weeks because the benefits for the baby are marginal, whereas the risks to the mother are at least potentially very, very serious.
It wasn't so bad.
Really?
Yeah, it's okay. I'd had a few people had said that they can be.
Yeah, they
that was
can,
okay.
especially, and they can sting for a little while afterwards as well.
That's perfect. Thank you. If they're supposed getting pregnant, before getting this news as well, was all made the whole situation a little bit scarier.
I think if the baby wasn't involved, you definitely would have been getting treatment already.
Yeah,
100%.
Yeah.
It's tough, and especially tough to see Mary go through it. Myself, I'm pretty laid back, and I think Mary helped me be more relaxed because she's very pragmatic about things, so
I'm gonna cry.
I kind of just followed Mary's lead with it. It's no point me being upset when Mary's not too upset about it, so yeah, Mary helped me get through it more than me helping Mary get through it.
He was just so strong through it all. Like, even when I had the neck dissection surgery in Beaumont, like, he didn't leave my side for the week. And before the surgery as well, we obviously were told that there was a risk of a miscarriage. So that then was just the priority at that point as well. Just that the baby would be okay. So yeah, if it wasn't for Mark, I probably wouldn't have been as strong. A lot of people actually say about his parents and my mum that we're very laid back people. Mark probably even more so than me. So yeah, we just take it a day at a time, and yeah, I think we're going to look to the future and hopefully have a little one to look after in a couple of weeks.
Look at your little bump, huh? You're gonna have a baby.
Expecting their first baby are Brazilian couple Moniki and Adriano. Moniki's in the early stages of labour, but there's a long way to go yet.
We decided together to go walking the stairs, go up and down. And Adriano was really tired, and I was like, that, let's go, I have to do that.
I was using the lift already. Oh, Monica, I
meet you
I'll
upstairs.
meet you there.
Yeah.
No.
It's just a joke.
Yeah,
He was there with
together.
me all the time.
Yeah.
After almost a day of walking the corridors of the Rotunda, Moniki and Adriano's pacing has paid off at last.
We used to work in a call center company in Brazil.
How are you?
And then I saw like a very beautiful woman and Jesus Christ. I have to start to talk to her.
How are you? I'm Jenny. Nice to meet you. You too. Adriano. What's your name? Moniki.
I think he has a very loud voice, then everyone can hear Adriano talking and, hello, how are you? Nice to meet you. Then for me it was like very funny.
Can you hear it? The like.
Yeah.
See that bit when it goes out to your baby has hiccups.
Yeah.
Oh, yeah?
Oh, yeah, I can feel now.
Oh, yeah?
You can hear the little bit like, you can hear the hiccup in it.
We always wanted to have like kids.
Yeah,
And then, 1 year ago, we just started to say like, yes, that's the moment.
Was late night around 11 p.m. I think.
Yeah, always like that.
Yeah,
She
did.
liked to do these stuff late night.
And then I did the test, and then I saw like, oh my God, look, I think I'm pregnant. And he was like, oh, Jesus, oh my God, oh my God, oh my God. He was more nervous than myself, I think so. I didn't expect that the pain was really hard like that. Can I get up now?
Yeah, do you want to get onto the wall?
Oh, yeah. So I was like, oh my God. Oh my God, I was starting to dance with you all the night.
I never did like that in my life.
He's Brazilian, but he doesn't
I'm
like.
terrible on it. Yeah. And normally I have to drink a bottle of whiskey to start to dance.
It's not true.
It's not easy.
You are not really Brazilian.
No, I am Brazilian, but I'm terrible on it. But I know I'm very good to play football.
Ah, yeah, it's true.
We're telling them all those little tips, how to get into labour. I
suppose walking and keeping upright and the hot curries and putting the partners on a promise.
Does that mean?
Oh, having sex.
In keeping with her medical plan, Sligo athlete Mary is back in the Rotunda at 35 weeks gestation. She's been given medication to induce delivery, and she and Mark are doing their best to bring on contractions.
The patience, I think, is sometimes not my biggest quality.
18 hours after induction, and Mary has made little progress with labour. Midwife Ruth is checking if her cervix has dilated.
So it's still a little bit thick. I have to push my finger through to get through it. So, and that's even just one.
That's one
Finger.
Okay.
Yeah. And that's with it. All right.
Ideally, I wish I was a little bit more dilated at this point, but at the same time, I'm still aware that I'm 35 weeks. So we're playing with a few different cards. So I guess, yeah, still a bit nervous. Just want the baby to arrive safe and sound. I suppose I would like to avoid a C-section, just because I know the recovery can be a little bit more difficult with them, and I suppose I am a little bit aware that I have to go for radiation treatment afterwards.
The disadvantage of a caesarean section is Mary's physical recovery afterwards will be somewhat more challenging, and it could indeed delay her preparation for receiving subsequent radiation therapy.
Are you very emotional, or are you just get this step sorted first before?
I am a little like that.
Yeah.
Before I left home in Sligo, there was definitely some emotion.
Yeah.
Like I'm funny because I'm like, I'm fine, and then I'm emotional, and then I'm okay again.
Yeah.
To be honest, the kind of pregnancy has been a good distraction from all the
Yes.
other
Yeah, the
cancer
other things,
stuff.
something
Yeah,
to
exactly.
focus on.
Yeah, that's the thing. And like even
look very
waiting
well.
for-
Do you know what I
I
mean?
know
Yeah,
everyone
you
says
look
that.
great.
Everyone's
Yeah.
like, you look healthy
Yeah.
and stuff like that.
Yeah.
So it's hard to think that there is something
Yeah,
else going on, you know.
Okay, I'm just gonna have a little listen.
Over the past number of hours, Mary has been making little progress in labour. An added concern for Professor Malone is that the baby is now showing signs of distress.
We re-examined you. Your cervix is barely 1 to 2 centimetres. So it hasn't really changed much
Yeah.
in the last quite a few hours.
Yeah.
And for the last hour, we're seeing dips in the baby's heart rate with each contraction.
Okay.
When I'm seeing this level of dips in the baby's heart rate, this far away from delivery,
Yeah.
I think is quite unlikely that a preemie baby is going to tolerate another 4 or 5 hours of labour.
Okay. Yeah.
So for that reason, despite us trying hard with all of the various medications, yet induced, the right thing to do is caesarean section.
Yeah.
Is that okay?
Yeah, no, that sounds good, yeah.
All right.
Thanks a million.
Okay.
I think once the baby is struggling,
No, you're right.
we tried.
Baby's heart rate started to dip. This suggests that the baby's umbilical cord is getting squeezed. And healthy babies can tolerate squeezing the cord for a short period of time. But eventually, if these squeezing the cord is recurrent, even healthy babies may suffer a lack of oxygen. Now, I'll give you that.
Knife for 47.
Okay, a couple of straights, please. A little bit of stretch now, Mary.
Okay.
Okay. Just that fluid there. Just a little bit of pressure. That's fine. That's enough. That's enough. The baby is great and is lovely and pink and screaming. Mark, can you see? Can you tell what you have?
Little boy.
Little boy. Can you see? There he is.
Thank you very much. Thanks for everything. Yeah.
So well.
Brilliant.
So Mary, congratulations. So let's have a look at this fella. He's a muppet. Yeah. Look. He's a lovely colour, isn't he?
Yeah, he is. That's what I was just saying. Like, you know, life throws curveballs at times and you just got to roll with it. And yeah, I definitely would tell people little things, don't sweat them because life is short and life is precious, so just enjoy it.
Hello. Just trying to open his eyes there, he was.
How you doing? Oh my God, he's so little.
Just out there. You got it?
Oh, yeah. Hey, little guy. Trying to open up your eyes. Oh my God, you're so tiny.
Yeah. What do you think?
I don't know who he looks like.
More like you, but...
Do you think?
Lips and a nose. The plan was to get this far, get the baby out, and then move on to the next part, which is getting treatment, and then after that, hopefully everything, we'll just move on then, and that's it.
It's like a little old man.
Yeah.
In a way, it's almost been a bit of a blessing. It's even more of a miracle that we've got to 35 weeks and hopefully have a bright future ahead of us.
Yep.
Midwife Nick is the first of 11 midwives arriving on the delivery suite at the start of their night shift.
Well, I had just a lovely day. Are we busy up there?
We're busy now. We're busy, yeah.
He's been assigned to room 9 to care for Moniki tonight.
Is there anyone from your family over here now for
Yeah,
the
my mom.
baby? Your mom?
My mom coming
Brilliant. That's great.
in January.
That's great.
She's going to stay 3 months.
Oh, very good. Very good. That's great. At least, to have help as well. At
Yeah,
home
she's
for the
at
first,
home alone, just waiting. Oh my God,
Is the
what
first
happened?
the first grandchild?
No, my brother has 3 already. It was really different for me because I didn't know that could have a male midwife. It was really nice, actually. He's really, really nice person as well. Funny.
Yeah,
and we had a really good time together.
What's your name again? Sorry. Nick. Good. Nicholas. It's like in Brazil we have this name, Nicola. I think you don't expect to see that. Because I think more because the name and midwife, like.
Was it hard to pick a name?
Yes, was maybe 2 weeks.
So you definitely wanted to find out what you're having?
I think it's very important to have man and woman doing the same job, and for me it's amazing to see.
Where are you from?
Who?
Which of the Canaries
Me?
are you from? Yeah.
Oh, I'm not from the Canaries.
Why do you go from the Canaries?
No, I'm from, do you know where Gibraltar, the British colony?
Right, yeah.
Right beside it.
Where they have those unusual monkeys.
Yeah.
What do they call them?
Monkeys.
No, they're funny monkeys though.
Are they? We call them monkeys.
No, they're different ones than the regular ones.
Well, I know, yeah. I don't know which type of monkeys now.
I don't know, they're different. I just know that there's different monkeys in Gibraltar.
There's quite a few mums in our department and we say, oh, aren't they so lucky coming in now with their bags? So we love that. And we're like, but we so don't want any more children. But we just keep looking at them going, aren't they lucky? Now it's all ahead of them, so.
Moniki has been in labour for 5 hours. The pains have been increasing in intensity, and it's hard for Adriano to sit by and watch.
I would like to share this pain. I would like to take some pain for myself, but you can't. You cannot do nothing. Just try to say to her, like, breathe. For her husband, it's a big challenge as well. But she's...
You did a great job.
Breathe.
You don't know how it's because that you can say.
Take back, please. Breathe.
You never know, labour is unpredictable and things can change very quick, but you have different things that might tell you that it's gonna be a long night.
You're doing fantastic, okay? We're not going to increase the oxytocin anymore because you're contracting very well. You made good progress. You're a very good 3 centimeters dilation now. Okay, but it could take from now 7 to 8 hours. before you see the baby. Okay, I know you didn't like the gas, but the epidural is an option now only if you want to go for it, okay?
It was midnight. I was thinking that I didn't want epidural, that I could hold by myself.
You could have a break, go to sleep, for a few hours and, get a bit of energy back, for pushing. But it's your decision, okay?
We were looking just to try to have everything natural. We checked like 3 centimeters and maybe we'll take like 7-8 hours more with that pain.
Oh God, I was thinking about, my God, just 3, I need 10 and it's very painful already. How will it be like that? Then I asked for epidural. Yeah.
And then when she had this medication, our life changed. I could see my wife again, because before was just a person trying to breathe and she couldn't listen, she couldn't talk and nothing. And then when she had this medication, so now I can see Moniki and she could sleep, and it was amazing to have it. Oh, jeez. They said to me, Adriano, we can have a small bed for you. Oh, I started to cry, I think.
Nice.
Your camping. Is it not very comfortable?
Oh, it is.
No, it's very, very comfortable. Oh my God. Oh, Jesus, was amazing.
He was very happy. Oh my God, I can have a bed here.
Yeah.
I don't know if you slept. But
Oh, I did.
Oh, great.
We have just reassessed her now, and she's still the same.
Okay. At only 6 centimeters dilated after 13 hours in the delivery room, Moniki's dream of a natural delivery is slipping away.
Things are going slowly.
Yeah.
You don't expect it to be like 20 hours doing that, and the stress is so high.
Going forever, and the baby's fine. You're quite well, and chemistry, you feel comfortable at the very least, but we can't leave it at 6-7 centimeters for forever, okay?
At that stage, I think she knew herself that, at that point, that it was going to be a cesarean because her cervix hadn't dilated. Now, I'm going to ask you if you just have a seat here and we'll get you organised in a few minutes, if that's okay.
When she got pregnant, yes, we don't want C-section. Let's go to the natural one.
I was frustrated because I was so close. I think the right decision, it's for your safety and the baby, is the C-section.
This is just this Irish test, Irish test,
There was very hard as well, because you see just half of your wife, and a lot of like computers, a lot of medications, and a lot of people there. And it's a new experience. You don't know. You don't have any expectation for that. And for me, was a very, very hard moment to see all this kind of
Adriano
situation happening.
Nervous.
Oh yes, I was just, my God.
Stretch again, I'm really sorry. Good, so the diameter retractor, please. Right now. Fundal pressure, please, yeah? There's the head, we're just delivering the head.
Lots of pressure, Minnie.
Hello.
Oh, here comes your baby.
Okay. Yeah, keep going. Come on, baby. Now. Hello. Hello.
There you go. Happy birthday, baby.
10:46.
Now, how are you? Fine. I was going to show you here on top, baby, so you can see here. Look up, look up, look up.
Hello.
Oh my God.
See, it's a girl.
Hello, Sophie.
Congratulations.
Thank you.
Congratulations.
She was there, amazing. It's unbelievable. You don't know what to do. Like, jeez. She has more hair than me.
She's gorgeous.
Brava, guria, tu viu?
And after when she born, I was like, oh, it's a new world, new life, completely different, new love.
For a father, it's like 10 months of pregnancy. Okay, you see the movement, you are there all the time, but you are not feeling as the mother, I think. And then it's your time to start to feel as well.
I'll pass her up. So if you just pull your top out, there, and pull it down over the top for you. Yeah, that's it.
I cannot explain what's the feeling. It's something that I never had before, and now I have this thing, and I want to keep this for all my life.
Now you can't really see her there, but it's just no.
Very nice, yes. Oh my God.
Okay.
Thank you so much.
You're welcome.
O que tu tá fazendo aí? Lindona, né?
When I saw Adriano and he was holding her, his t-shirt, I was really, where is she? And she was just inside, and he was like, oh my God, she's here. I think he's the best father ever. And partner. Also.
Tá aqui, amigo. Falei pra ela, não tem tempo.
There's been romances, but they were probably very short-lived at like barbecues or parties. But no, I definitely didn't meet any love of my life here. Not yet, anyway. My husband will kill me, don't put that in.
Hi, Kira, how are you?
Arriving into fetal assessment, parents of two, Kira and Mickey. When they first met, Kira was keen to make an early impression.
I texted him.
Yeah, you did, that's right. What time?
Half 6.
On a what?
On a Saturday night.
On a Sunday morning.
He was jumped, couldn't wait to go down to the pub to tell the lads. You never guess who texted me.
And the response I got was, really? That time?
Did you get any rest last night?
No.
No? It's just the discomfort.
We went for an early scan.
I need to take a closer look, she said, because she said it seems there's 2. And I said, sorry, what?
Yeah. And I started laughing. Kira didn't.
So, Lucy?
Yeah.
And this is Eevee here. I think that's the best we can do of the two of them. The two of them together. Eevee's bum on Lucy's head. And there's Eevee. You can see her hand really clearly there.
I was delighted then. I was hoping it was 2 boys, like, to even it up, you know, because I was already 3-1 down. And then, then we found out it was 2 more girls. So it'd be 5-1 down.
I was thinking, God, 3 kids under 2. Like, how will I cope? That's what I was thinking. And then I went for my 16-week checkup, and they scanned me. That's when we got the news.
At their local hospital, during a routine scan, Kira and Mickey were told some devastating news.
She basically sort of said, your little baby's he's going to die, was the term, was the words we used. Your little baby's going to die, and that's the words that stuck in my head.
All of this dark area here is the amniotic fluid belonging to Eevee, so this is quite increased. We wouldn't normally see this degree of amniotic fluid. So we can say, compared to Lucy, that she is lacking the skull bone.
I was given the diagnosis that I was carrying the baby with anencephaly.
Anencephaly is a failure of formation of the fetal skull bones, and this leaves the brain tissue exposed. And so essentially what it means is that ultimately the baby has minimal or no residual brain tissue left. Now obviously this is a very serious abnormality, and unfortunately one that means that a baby cannot survive for any significant length of time after delivery.
It sounds selfish now, but I couldn't think. I could only focus on the news I was given, like, you know. And everyone would say to me, like, you know, you're going to have to, you know, stay healthy, and, you know, you still have a healthy baby in there.
but it took over. You know, I just felt sick every time I thought of it.
It was just filled with worry then. There was no excitement, there was no looking forward to it, and it was like my whole head was like, you just had to, always through it, you just had to get through it.
Little pinch.
You're all right.
Kira has to have a difficult procedure today to drain excess amniotic fluid from her womb.
Oh. Are you all right there?
When a baby has anencephaly, the problem is that they often don't swallow, and when a baby in utero is not swallowing the amniotic fluid builds up. And so this is what posed the risk of the pregnancy in this case. As the pregnancy went on, there was more and more fluid building up around Eevee. When there's a lot of fluid, obviously, first and foremost, it makes the mum very, very uncomfortable, but it also significantly increases the risk of preterm labour.
What should we out?
250 mils. I'll probably do more because they're about 60 in each, really. That's the target. Ideally, if we could take at least a litre off, but let's just see how you are. I mean, we keep going for the defence, is it? Yeah. The risk of actually doing it is that in doing the procedure, you can sometimes trigger labour. So while on one hand you're doing it to reduce the risk of a preterm labour, it in itself is a risk for labour happening. The main discomfort from this procedure actually comes from the uterus contracting. When you put a needle through the uterus, because it's a muscle, it will contract.
Okay, well done. All done.
Yeah.
Yeah, it's hard to say you're having twins. Like, a few people have said to me, "Oh God, you know," and especially with a 19-month at home. You know what I mean?
Hands will be full and all that.
Oh, your hands will be full. You know, three babies, and you'd just rather not correct them. So you're just like, yeah, you know. But then deep in the back of your head, you know, you're only getting to bring one baby home, like. So yeah, it can be tough.
Are you living out now? You're not at home?
Yeah, no. Rent's only $450. No, I moved out when I was like 19.
Really?
Yeah.
I just assumed you were...
No, I live with 3 lads. Yeah, it's great crack.
You still got the dog?
Yeah. And Ralph, yeah. 4 lads.
Arriving into the delivery suite in the throes of labour is mum of 4, Ekaterina.
Now, so you feel contractions, you can breathe on the gas there. Nice, slow breaths. All right.
Я приехала в Ирландию просто поработать и заработать деньги, потому что у меня в Молдавии была дочка, оставалась дочка, и я просто хотела заработать на квартиру. Ну и тут я познакомилась с мужем, и у меня планы просто изменились.
Is baby boy or girl? You don't know? Surprise.
I think it's a girl, maybe. Тут мы зарегистрировали наш брак, тут были наши встречи, тут рождались наши дети.
And you have 2 boys and 2 girls already, don't you?
No, I have 1 boy and 3 girls.
1 boy and 3 girls.
Я очень хотела большую семью, потому что сама моя семья из большой семьи. Моя бабушка имела 8 детей, моя прабабушка 14.
Is that all pressure, Katrina, you're feeling? Is it all? Is it all pressure?
Do you feel like you need to go to the toilet? No, do you feel like you need to go to the toilet?
Sorry, I speak very bad.
No, that's okay.
When there's a language barrier, usually the partner may speak English. But in this situation, because her partner was at home looking after the children, he wasn't there for us to ask questions and try and communicate through him.
Is it? Do you feel like pushing? Yes. Okay. You need water. Okay.
Katerina was overwhelmed with the pains when she came over, and it was obvious from once she arrived that she was going to deliver fairly fast.
Katrina, is it okay if I check to see if the neck of the room is fully open for you to push? Will I?
Я когда родила первую дочку, у меня, да, действительно были боли, и я думала, что после этого больше не буду иметь детей, я больше не хочу, такие боли у меня были сильные, но это были первые роды у меня. А после этого, когда я уже рожала ребенка, я просто была приготовлена к этому.
Is it all pressure you're feeling? Do you feel baby move down? A little. Okay, all right. Will we move you up the bed a little bit? No. Okay.
Lucinda? You're not just No, I'm grand. No, lads, come on. Lads, don't make me feel old. I don't. I'm grand hanging over here.
Well done, Katrina.
Just 40 minutes after arriving in the delivery suite, Ekaterina is close to giving birth.
The baby's head is nearly born now.
We're nearly there. Well done.
Good girl.
You know that they're overwhelmed with the pain, and you know you have to reassure them that you are there for them and that you will get them through this and that it will be short-lived.
That's it.
Well done.
It's okay? Do you feel it coming up?
Yeah. Yeah, it's coming.
All right.
Well done.
Well done.
Ну, все мамы кричат, потому что, конечно, есть боли, они очень сильные, но эти боли забываются. Когда ты рожаешь ребенка, все эти боли как бы прошли, как будто и не были. У всех боли есть.
Now, Katrina, give us a small little push. Katrina, give us a small little push. Now, blow. That's it. Now, Katrina, your baby's head is delivered. Your baby's head is delivered now, okay? Right. Okay. That's it. And again. Katrina, take a deep breath in. There you go.
Well done.
Oh, it's fine, big baby. Look at your baby being born. Look down. Look down. Yay! Well done. Oh, wow. Yes.
Well done.
Do you know what you were having, Katrina? Did you know what you were having? Do you want to see? Look. A little boy. Look at him. Isn't he lovely?
Я думала, что скажет мой муж, потому что он тоже ждал девочку. У нас было имя просто для девочки.
Have you a name for him?
I don't know. No, you don't know.
I think it's girl and put the name Abigail.
Okay, all right.
I don't know.
Okay.
И когда я всем сказала, что у меня мальчик, только моя дочка сказала, я сказала, что у меня будет братик, а не сестра, только моя дочь верила этому.
Это я только что родила. Мальчика. Да.
Ну, я родила. После того, как я родила, я позвонила сначала первому мужу и сказала, что у нас сын. И сын сказал, как сын? У нас же дочка. Я говорю, нет, у нас сын. И все были рады, очень рады. Все там кричали, особенно моя дочка старшая. Муж его назвал, Альберт.
Are they happy? Good news? Boy? Every happy boy.
Ну, я когда родила первого ребенка, мне казалось, что у меня самый красивый ребенок из всех, что у меня самый лучший ребенок. Но когда я уже родила мальчика, я то же самое думала, у меня самый красивый мальчик из всех, у меня самые красивые дети. Ну, я не отличала детей между ними, у меня все дети красивые, я их просто всех люблю.
Just hours after being born, Ekaterina's son Albert had an unexpected spike in temperature. For the past 2 days, he's been in the intensive care unit for treatment and observation.
When I delivered my baby, everything is okay. Temperature is 37, it's okay. 38 temperature. I don't know what's happening. Now I'm waiting result. I don't know.
He's a lovely baby.
What's his feeling now?
So he's no fever now. He's good. We're treating him as if that he might have an infection because he had a temperature after he was born, and then he had another temperature again as well.
Now it's well, yeah?
Now it's good. And yesterday when he came down for his tests, we noticed that the oxygen level in his blood was dipping a little bit. But it's been fine since he's gone into his little box. And then there was also, some people said they noticed a little noise when he was breathing. So I'm just going to open up the incubator and see if I can hear it.
Right. Что это у меня первый случай в жизни было такое, и я не понимала, что вроде нормальный ребенок, большой, красивый, а он сидит в инкубаторе, а там сидели все маленькие дети. Я не могла понять, что происходит. Я просто...
I'll wait and hear about the noise he's making when he's breathing. I'll speak to the nurse who's looking after him and see.
That's it clear here? Here it's clear?
Here it's clear when I listen. He has lovely breath sounds. It doesn't sound like anything.
Я очень хотела домой. Как мама, все хотят домой.
He's feeding well, which he's doing at the moment. And if he's gaining weight, which we don't expect him to at the moment, but he will, then we don't worry too much about that noise because it tends to just go away.
Thank you very much. I'm relaxed now.
Congratulations, he really is lovely.
Now it's fine. Monday I can go home. Oh my God.
All right, so we do these clay prints? Yeah. All right, I'm going to take them.
After a few days at home, Ciara, who's had 2 previous C-sections, went into early labour and delivered her twins by emergency C-section.
Yeah.
Ciara and Mickey named the girls Lucy and Eevee. Eevee sadly passed away shortly after birth.
They had to rush me to theatre. But there wasn't even any time to give me the epidural or the spinal block, so they had to knock me out, which I didn't want because obviously Eevee. So
they had no option.
They had no option because the baby, I was fully dilated, the babies were coming. Lucy was born at 5 to 6, Eevee was born at 5:57, and she stayed with us for
7:03. She went, so it was an hour and 6 minutes. She was alive.
She waited till I came round.
She did, yeah.
So that was nice. I was delighted to see her then still alive. And to get a few minutes even with her.
Now I might do your toes first. Now, chicken. Good girl. Ah, that's perfect.
They brought Eevee out to me and I was there on my own. I spent the time talking to her and telling her about, telling her about who I was, who her mum was, and her brother, her sisters, and I said about granny, and, grandparents and cousins, and I told her about the dogs. But I wanted her to know all the things. Even though she was only there for an hour, she was somebody, and this is what she would have been.
Bereavement midwife Emma takes hand and footprints from Eevee's sister Lucy too.
I'm sorry, chicken. I know. I'm so sorry. That's it, sweetheart. That's it. All done. It's all about making memories. I mean, they started off together so that every memory that you make, as much as we can, we include Eevee and Lucy. So, like the clay prints, while we're doing them for Eevee, that we'll do them for Lucy, and Mum and Dad would have them together. All done. Slightly more difficult. She moves a lot. Yeah, she really wiggles. So that's the two of them. So Lucy and Eevee.
Well, there's not that much difference in the hands.
No.
I thought Lucy's was going to be a lot longer.
Okay.
We knew they were not going to get much opportunity to share anything, so we hadn't thought about middle names for them. So we called Lucy May Brennan and then Eevee May. So they share a name.
Yeah, that was lovely. Something of the two of them. So
yeah.
Yeah. Hey, yeah.
Lucy is recovering well in intensive care.
Is this the first time I've seen her face?
That's amazing.
You can say hello. Hello. This is the first time I've seen with nothing. Yeah, every other time it's been a mask or a hat or something. I can't tell now who she looks like. You open her eyes? Hey, yeah. She was giving straight to me outside the ward. Now, I was an absolute mess at the time. But, you know, I think it all came out then. Since that, it's more concern for Lucy, you know. I wasn't coming in here knowing it was going to be a happy ending. It never was going to be a happy ending. Well, in regards to Eevee, but with Lucy now, she came a bit early, which is just added to it all, you know. Nothing holding her back now. It's just whether or not she can push on, like, but what would I know about it all, like, you know?
Perfect.
This side?
Yeah.
It's okay like this?
Yeah, perfect. Hello, little woman. Hello, little woman. No. Goosey goosey. See, last night, she was waking me going. That's the first time I think it was killing me. It's horrible. Whereas usually she's asleep, so you're kind of like, right. You know, but she was like staring at me as if to say, where are you going? You saying hi? I'm exhausted. Yes. She's worth it. I see you. I do. I do. Yes. Yeah. Say hi. Yeah.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out. Come on.
Events to be remembered and retold for generations to come.
Well done. You're okay. Your baby's nearly here. Oh, here we go.
I'm now here 18 years.
And on the first day, I was going into the canteen for my lunch and I tripped on the back stairs, so I landed with a bang on the first day. I actually had to get my lip stitched. But anyway, sure, it was grand. I had to come back the next day, I had no choice.
Arriving in the labour ward are teenagers Jake and Alex, who are expecting their first baby today. They're no longer a couple, so they plan to co-parent. Also supporting Alex is her mum Linda. Jake doesn't think her first impressions of him were good.
Don't think she liked me, being straight about it. But I think she's okay with me now, I hope, anyway.
Are you alright, Jake?
I'm all calm, not bothering me.
You're not the one giving birth.
They know their place, men here.
Well, like, I didn't tell my mum until I was actually in a hospital for the booking appointments.
So you actually told her by text?
Yeah, I did. My mum just cried for a few days, but eventually she accepted it and she was grand. But she was so supportive and she supported me through the whole pregnancy, which was so good as well. We actually met online, but he doesn't like to say that. We met on Tinder.
Mm-hmm.
Right?
Yeah.
You from Nab and you from Swords?
Yeah.
Where did you meet?
On Tinder.
Where?
On Tinder.
We were kind of on and off for a while.
Yeah.
Up until about, I'd say January, we were solid up until like January, and then we were on and off. 12 to 5.
Are you going to go back to college or what are you doing?
Not this year, no. Or do an apprenticeship this year.
Football as well?
No, steel.
When Jake found out Alex was pregnant, he made the difficult decision to turn down a football scholarship in the US.
Football was everything from a young age for me. I signed for Shelbourne, then I signed for Cherry Orchard. I went back to Shelbourne to play League of Ireland. It was rough to accept, but then, as my mother puts it, you know, what's for you won't pass you by.
In Spain, at least, everybody's crazy about the football.
Is there any famous football players from Spain?
Yeah.
Who?
Them all.
Who?
All of them, yeah.
All of them. Pedro.
Pedro, yeah.
There's Pedro, there's Casillas, Valdez, there's loads. Piqué, Sergio Ramos.
Piqué, yeah.
Arbeloa.
There's...
Azpilicueta. David De Gea.
Is that the one? Is that one of them?
knows
The
better.
one that bit like the other person?
No, that's Luis Suarez you're thinking of. It was the same thing the whole way through, on and off.
Yeah.
Because we were just both childish, not gonna lie. We
Yeah.
both just couldn't talk to each other without arguing.
Yeah.
So
all
I
the time.
just walk away from the conversation and she'd do
Yeah.
the same. I haven't a clue what I'm looking at.
Baby's heart rate is there. Top one. Put your glasses on.
Sure.
The glass. That's like my parents aren't together, so I naturally just wanted to have a family, like the dad and mum together, and obviously have a family. But like it wasn't working out with me and Jake, and I obviously like didn't think like I was so upset at first, thinking, oh, my baby's not gonna have a proper family. But obviously, as more of my pregnancy went in, I was like, my baby would be fine. Like me and Jake were gonna co-parent anyway.
Be here, like.
What?
She's just gonna be here.
Yeah, she can't wait. That's where they get weighed.
Then she gets put here. I just didn't think it would be good for the baby to grow up in that kind of environment where me and Alex argue every week and she sees that and thinks that's normal. Then when she gets to like 16 or 17, she picks up with a bloke that argues with her constantly and is probably rude to her and doesn't treat her nice, and she thinks that's normal. Like, when that's not normal. It's not how you're meant to be.
Potatoes and lights. Hold on a minute there, sorry. I don't know, I didn't hear anything about a caller. Alright then. Hello, who's that?
Hi. I said I know all the stuff here. I feel like part of the furniture.
Waiting for a scan at fetal assessment, mum of one, Kate, didn't have to look too far to meet her husband, Peter.
It was an office romance back
We
in the
worked
day.
together. We both worked in the bank. We tried to keep it secret at the time because he was a manager, or like kind of a manager level, and I wasn't. So it would have been kind of frowned upon. So we thought we were keeping a secret, but it was like the worst kept secret. I think everybody knew.
And the rest is history, as to say, you know. So what, 12 years on now, are we?
Nearly 13. Yeah, nearly 13.
Yeah.
Kate comes in to be scanned every week because she's at high risk of a preterm delivery. Her first child, Billy, was born suddenly at just 24 weeks.
My back's been at me actually.
You'll start noticing symptoms that you wouldn't have kind of gotten to the stage of getting
exactly.
last time. So.
Yeah, and remind myself not to complain too much.
No. So she's head down.
Yeah.
Today, Kate is at nearly 27 weeks gestation, and so far, so good. It was a very different situation the first time round.
I was having the bleeding and cramps, but you're not thinking straight. You're just thinking, go to A&E, get it checked out, get the all clear, come home. And then carry on with our day. You're not thinking, we're having the baby now. Like, the shock of how small he was the only thing that you could think about at the time. It kind of takes your breath away. Like, he's probably the length of our hand.
They kind of had to run various tests, and they had to obviously put the
He's
line...
ventilated straight away.
The line in to ventilate him, etc. He was kind of just taken away then to be examined further, and then we went into the recovery room just in next door, and then he was whisked up to the ICU then thereafter.
127 days that he had in hospital was very up and down. Thankfully, he came through it. Thankfully, we got to take our little baby boy home. He came home in oxygen for 6 months. Billy was the year and 3 months when I got pregnant, yeah. So it's still very fresh, and kind of around the year mark is when you're kind of coming out of the trauma.
Kate was extremely nervous, even when I met her before she got pregnant, even making that decision as to whether to embark on a second pregnancy, because with one very, very early delivery as she had with Billy, there was a very significant risk that she would deliver preterm again.
I had 2 recent stays in hospital. I had kind of 2 scares that I possibly might have given birth early, but they didn't progress, luckily. I'm really, really happy to have gotten this far, to think that I was, once wondering would I reach past 24 weeks, to now actually have well bypassed that and gotten this far. I have this kind of dream that I want her to have her with me in the ward for the few days. So I didn't have any of this the last time, so I could change her and look after her for those few days. I think it's a really special experience for her, so hopefully.
The recent referendum that changed the approach to termination of pregnancy in Ireland represented one of the biggest changes and the biggest challenges in the history of the Rotunda. It is absolutely essential for the Rotunda to at all times ensure that patients trust us, that they know that the advice they're getting from us isn't based on our personal view, but our advice is based purely on the medical facts. What are the options that the patient has available to them, and helping them choose the right option for that patient.
So keep breathing.
In the delivery suite, Alex's pains are increasing and she's thinking of having an epidural.
Too much, is it? Yeah. You're doing good, homie. Keep it up. Yeah, she's getting an epidural now. That's what she's looking to get. Yeah, they're coming every 2 minutes. Yeah, they're really strong, like. Those were last night in where we were when we were only induced to take another room, and she was huffing away on the gas, like, do you know what I mean? And there's people roaring and screaming in there, and like people roared and screamed getting the water spoken, she didn't, so she's proper trooper and through, like, you know. She's doing well, like.
Just 5 minutes since having her epidural, Alex isn't feeling quite right.
Is it normal to feel like a bit like lightheaded?
With the epidural, yeah. So let me do this again. She did have an episode of low blood pressure. She was feeling lightheaded, she was sweaty and feeling unwell. And the baby's heart rate was dropping. So I just rang the bell and Annette came in the room.
I'll give the nieces a shout as well.
Yeah.
Is he?
Is he? Can I put the oxygen max on?
Anaesthetics around. Dropping the blood pressure. She's symptomatic. Her baby's heartbeat's dropped.
How much is 5? On the other, yeah. That's it.
Am I okay?
Sherry? It's okay. Your blood pressure's dropped a little bit, so we just check.
All of a sudden, like, my blood pressure went down and the baby wasn't doing well, and then all these doctors were like flooding around me.
What is the blood pressure?
93/50. She's symptomatic with it. And it was 126.
Jack's my name, another one of the ends.
Am I okay?
You're okay, your blood pressure has dropped a little bit.
feeling a bit dizzy?
No.
No, that's passed over, okay.
It's quite common with the epidural for your blood pressure to fall a bit, but yours maybe has gone a bit beyond.
So this is just to help the blood pressure.
Okay.
It's quite normal, don't worry. And how is the baby?
It's still, yeah. Take this side there. I might just stop. Squeeze my hand, yeah, if you need.
I went for a chicken fillet roll.
Yeah. He went for food, like.
Trying to recover, so we're okay here.
I knew I was in good hands, and that's all that was went to my mind. I wasn't scared because I know they know what they're doing, like they're doctors, and like they went to college for this, and they knew, like they know, so I wasn't scared.
Let's take this off, baby's all good.
Have I dilated or anything?
4 centimetres. 1. Oh, I thought it said 4. Oh, sorry.
Oh, I was like, oh, 4.
You were hoping.
Right.
You missed it.
It's fine.
Missed what?
My blood pressure dropped. And
Did it?
She just doesn't make big deals of things, and
No.
she wouldn't tell you. Like if she was in pain or anything like that, she'd try her best not to let you know.
But now the blood pressure's come up and the baby's heartbeat as well.
Looking forward to getting this baby into your arms for skin to skin. Yeah,
Kate has made it to just over 37 weeks of pregnancy. She and Peter are arriving in theatre for her planned cesarean.
We're going to have a baby. So Kate had what we call a J-shaped incision on her womb when she was delivered with Billy. So for that reason, we felt that it wasn't safe to labour. Look forward to meeting this little bambino now very shortly. All right, I'll see you in there in a few minutes, okay?
I don't think I could have gone through another premature birth again.
Not, well, 24 weeks, not a 24 weeks. But then, like, you have to ask yourself the question, if it happened, you know the choice, but to cope with it.
Yeah, you just get into it then, yeah.
Okay, just starting. This was a planned cesarean section. Everything was nice and calm. I think such a different experience for Kate and Peter to the delivery of Billy. Clip, thanks. Hello, gorgeous. Drop the drapes a little. Hello, hi. You're gorgeous. Hi, Mom. Hi, Dad. Can you see her? No. Oh, she's doty.
It was kind of a joyous occasion, hearing the baby cry. She got to cuddle her. It's a completely different experience. It was what we'd expected the first time around, you know.
The name Kate and Peter have chosen for their new baby has special meaning.
I lost my twin sister. It's going on 9 years now. So her name was Ruth, and I always said that if I had a daughter, I'd call her Ruth.
It's just amazing to hold her, you know? Amazing to see. Yeah, it is.
There's no wires coming out of her, and that she can actually, I was like lifting her up going, where's all her equipment? Like.
3 days later, Billy is visiting his sister for the first time in a place where, as a critically ill newborn, he spent his first months.
Hello. Hello. Little man. Hiya. Hello. I haven't seen you in a while. I haven't seen you in a while.
Thank you, yeah. Give me a kiss.
For us, it was the end of the kind of traumatic time and the beginning of the best time. It felt like the two times we're meeting. And I know it sounds really corny, but it's the only way to describe it.
We're going back to Billy's first home, where he stayed for 16 weeks. So, neonatal ICU. Julie, how are you? Look, Pop. Now, little man, yeah.
Look after you so well.
You go the wrong way.
No. Different baby, isn't he, Julie?
Oh my God, it's huge. The red hair.
I know. Didn't lose that. She looked after him in the first week. Yeah, on Paddy's Day. Do you remember on Paddy's Day? Yeah.
Bye-bye.
You go home with your 2-year-old who's kicking and roaring and screaming in the back seat like any 2-year-old should be, and a newborn baby all packaged ready to go like a normal baby. And it's just like, when we drove home from the hospital, I thought, we're actually leaving the bad days behind us. I can feel it.
Yeah, no.
Yeah.
Like she's using a bit of gas, but she's just like, you know, she's not really.
It's not like.
No, she's like, and then, you know.
More than 30 hours since she was induced, Alex's labour is progressing very slowly. She's been told it might go to C-section.
I thought when you get induced, like you have it that day, I didn't think it took about a fucking week.
I told you.
They could have induced you and just sent you home, realistically.
Hardly. What if I had her then?
You weren't.
Depends on
though.
the person.
You didn't know at all.
I know, but it depends on the person though.
But you didn't know.
I know. Did you, when you were in third class, did you ever grow like one of those little plants?
Yeah.
And then put your name on it. What?
Grass heads.
Yeah.
Sock filled with seeds and that. Yeah. Cool looking things.
Do you remember you had to bring? Did you bring in your own yogurt pot, or did they give you something to put it in?
We had to bring in our own.
Same.
Whoa.
I loved when it was a communion year because you just do so much colouring and stuff. Do you remember?
Mm-hmm.
Can you itch my belly for me?
Which part?
I hear it's tight. I can't itch. I can't feel it. I have no nails.
Yeah?
Feels good.
That's it?
Yeah. I thought he was really supportive. Like, he was like, oh, you can do it, and he held my hand, and he was reassuring me a lot that, like, obviously, like, you can do this, and I was a bit scared, I was.
Good hug. You're doing really well. Really proud of you, okay?
Okay.
I'm kissing you out, but you smell like sick.
No, I don't.
You do.
Thank you.
Fuck you. It's the reason you're in this mess.
Your fault.
It's not my fault, it's your fault.
Your fault too.
Partial.
Partial, yeah.
Argument. It's arguative.
I've worked in so many places. I think I'm chefing now about 22 years, 23 years. And working from the top Michelin star, I have to say working in the Rotunda has been more satisfying for the women in bed, and they could be really tired, really sick. And to take that lid off and say, yes, that is gorgeous, I'm going to enjoy this. And if it gives them 5 or 10 minutes, to me, that's brilliant. I'm delighted with that.
Waiting for her 20-week scan, Natasha is 21 years old. Expecting twins, she's soon to be a mum of 4.
When I found out it was twins, I actually wasn't even that shocked. It was just because the ones in my family are really strong, but I'm actually really excited. I can't wait.
I asked her to get with me when we were 14. I texted her saying, do you want to be my girlfriend?
There's no really date, like.
No, there's no date.
So we always said, like, oh, we'd want kids, but, like, never discussed, like, when.
Yeah, I never thought it was going to be so soon.
Are you feeling baby's moving yet? Like, in the last 2 to 3 days, I've felt.
Here with Natasha and Andrew today is Natasha's mum, Naomi, who is a twin herself. Natasha and Andrew's first child, Tyler, has cystic fibrosis, a genetically inherited disease affecting the lungs and digestive system.
So he's gone now, he has cystic fibrosis though. When they noticed that he had a blockage, they suggested, like, oh, does anyone in the family have cystic fibrosis, or have you heard of it before? And none of us have heard it. Like, we didn't even know we were carriers.
It was hard at the start because we were still getting used to all his medicines.
He's on 6 nebulizers a day. He takes 3 in the morning and 3 at night. He gets physio, like he can get like either like tapping or cupping and like a pep mask that like he breathes through, and like it like restricts his airways like to open them more. He likes going to the CF unit. He can play there, and people are coming in, obviously like they're paying him attention, and obviously he loves the attention. But when it comes to being admitted into hospital, like A&E or anything, he hates it because like he hates needles, like he's terrified of them. And especially like seeing him like when he's screaming, crying in pain, like you literally can't do anything.
There's a 50% chance that at least one of the twins will be affected by cystic fibrosis. Natasha and Andrew didn't want to do a test for it during pregnancy, so it won't be until the twins are born that they will know if they are affected.
Well, exactly. That's exactly it.
Obviously, I hope they don't have the CF, like obviously, like because I don't want them to go through like what Tyler's been through, like as in like hospital stays and like constantly getting poked with needles. If they do have the CF, like it's gonna be the same, like just adding in 2 extra babies, like. I know it sounds bad, but like I didn't think like CF would ever stop us from having more kids though. Did you? No. I just thought like if they have CF, like obviously like it's an illness and like it's not nice, but like they still have life and they still can like achieve stuff.
Great. Structurally, I don't have any concerns with the babies.
Yeah.
The scans are never 100%. Twin 2 is a little bit smaller, but still within the graph, so nothing to worry about.
Okay. Lovely. There you go. Congratulations.
Lots of pictures to have a look at.
Here,
Do you want
Daddy.
one tissue?
Oh, look.
Thank you.
Congratulations.
Thanks.
Will you stop dropping stuff?
Thanks very much.
Alex has been labouring for 7 hours in delivery suite 1. She's only 2 centimetres dilated. A C-section is looking ever more likely.
Hi, how are you? We changed your shift at this stage on the night staff.
Hi.
So they're leaving you till 9 to make the decision.
Yeah.
So I'm going to get you in a gown anyway, okay?
I have been told that Alex was probably going to have a caesarean section because the tracing at times, the doctors weren't happy about it, but we were going to give her another short while, and the contractions began to build up again.
I'm going to stop in a few seconds now. That's it.
I feel a bit sick.
Okay, just here. Well, yeah, it's just she's in more pain now, Jake, and the epidural isn't really working that well. So she doesn't want to be any more pain.
You haven't a clue. You're just part of the furniture. You're just watching, that's all. The women do everything.
Okay, so what we didn't want to happen is, remember when you got the epidural and the baby's heart rate dropped because your blood pressure dropped. So we want to go very softly with the top up.
Want Jake to hold your hand? That's it, do your breathing. Good girl.
Newfound respect, honest to God, because, like, as a bloke, when you think about women having kids, you're like, oh, why are they making a big deal, like, you know, have the kid, like. But when you see that now, when you're actually in the room and you see her having that kid and you see what she's going through, it's completely different. You never think you can feel like that about someone till you see them having the kid, till you see what they're going through for you or for your child. It's amazing to see, like.
Yeah. Yeah, he hasn't said anything like that.
I heard you feeling a bit of pressure.
Yeah.
That's good. So I might just check on you. She's coming. You're ready to have your 10.
So I was so shocked. I was like, from 2 to 10. Oh my God.
Yeah.
So we were all so excited. It was looking less likely that she was going to need a caesarean section.
Now you got one there now. So just take the gas away. That's it. And just give me a push down. Just drop out the knees a little bit.
No, it literally felt like 10 minutes. I actually don't know how much I pushed for.
Good girl. Blow, blow. Just drop out your knees now and blow. Good girl. Just drop out your knees. Good girl. Good girl. Look at a small little push. Now keep the legs nice and relaxed. They're nice and relaxed. Good girl. You're brilliant.
Just 3 pushes, I'm not going to lie to you.
Yeah, like she was coming, she was literally coming so quick, like I felt the urge just to push and push.
Good girl. Well done. Keep the legs nice and relaxed. Good girl. You're doing it now, you're doing it.
That's it, keep going, keep pushing.
That's it, you're brilliant.
Now she's there.
She's coming now.
She's coming.
Another little bit, another little push.
Another push.
Good girl. Well done. Now we just take the cord from her neck.
There you go.
She's absolutely gorgeous.
Gorgeous.
Well done to you.
Well done.
Jake, Daddy. Oh no. Here we go. Now, see the white bit? You just cut after that. Good man. Yeah, just here, yeah. Go ahead, don't do our piggy. That's it, now go on.
Once I cut the cord, like, there was just that connection was there. Like, it's weird to explain, but when it came out, it doesn't feel like, and then you cut the cord and you're like, that's what dads do. I'm now dad.
Ah, she's so lovely.
She's gorgeous.
Now.
There you go.
Now. Now.
Hello, Missy.
Congratulations, everybody.
Thank you.
I don't know how to explain it, like we just connected again, I guess.
Well done.
Not bad, was it?
Like I felt like it's never going to work because we're always fighting all the time. Like once, like when Amila came here, I felt like that all went away and it's all stupid, and like I do feel like we can actually be together now. Like we do understand each other a lot, don't we?
You are the image of your mother, honest to God.
Yeah, it kind of comes down to respect. Like, I found a whole new respect for Alex once I seen her having the baby, like.
Yeah.
And you can't be kiddie about things. You can't be acting like a typical 18-year-old lad or 19-year-old girl. You have to be an 18-year-old man at that stage, you know what I mean? You have to act proper, and you need to find that respect for her.
Yeah? Talk to me.
It's so mad to think that we grew, like women like grow these human beings with like they have brains and like a nervous system and fingers, and it's so weird that she fitted in my stomach like that. That's what I thought, and I was like so mad, and she has this nose and these eyes, and it's so mad, and she looks like me. Everybody's like, oh, she looks like you so much, and oh, but she looks like Jake as well.
That's a Mead woman there.
Getting pregnant is seen as a natural process. However, current accepted statistics across Europe are that approximately 1 in 6 couples will have some difficulty becoming pregnant at some point in their reproductive life. Treatment may be the only option forward for them. The vast majority of IVF cycles are not going to be successful immediately, and it's our responsibility to keep a couple hopeful, but realistically hopeful.
Arriving into the Rotunda are Stacy Jean from Galway and Allan, a native of Waterford. When they first met, they had eyes on a different prize.
We met back in 2010 at the Ladies' Day of the Tremor races. So we don't count the day at the races as our first date because it was only kind of towards the end of the night that we realised that there was a bit of a spark there. Yeah. We had our first kiss that night.
Yeah, you were trying to set me up with your best friend.
I was trying to set you up, but it doesn't really set a romantic tone when you're trying to hook you up with somebody else.
He was very confident.
Some would say overly confident.
Very confident and funny. He was very, very funny, to be fair. So I remember we were up in one of the pubs in Tremor after the races, and a couple came over and said that we were a beautiful couple. They were like, geez, you look lovely together. And we started laughing, going, we've only met, and she thought that we were together for years. So very early on, I think we discussed a family and said we realised we wanted the same thing, we had the same morals and that, and we wanted children, both of us kind of did.
We just expected that we'd get pregnant pretty quick, and like everybody else, that we'd get married and maybe go on honeymoon and, you know, conceive there, have a baby, and, you know, 9 months later. You all right?
Yeah.
You sure?
Yeah.
Oh.
I had a lot of fibroids and a lot of cysts and that for the last few years. Growing up in that, I always had stomach pain and that, and then my appendix burst and destroyed one of my fallopian tubes as well when that happened. So we knew there was going to be some issues, we just didn't realise there was as many issues.
You're nervous.
How's everything going through now?
I know.
After numerous tests and investigations, Stacy, Jean and Allan went to meet fertility expert Dr. Rishi to find out why they weren't getting pregnant.
Stacey's bed was right up against a window in the hospital, and it was lovely outside, and we were sitting there, and Dr. Rishi is a fantastic doctor. Like, he really softened the blow, and kind of, you know, he was great with us, really. Like,
it would have been very difficult for them to conceive as a couple naturally with the problems that they presented with. A surgical approach was absolutely necessary prior to undergoing IVF, and that would have probably been realistically their only opportunity.
Following 3 pelvic surgeries, Stacy, Jean and Allan started a series of grueling IVF treatments.
The first year I was very embarrassed and ashamed.
For no reason, there was no reason to be embarrassed.
Yeah, but it was just human nature, the feeling. So we didn't tell anybody, even though my family probably knew. The second year we told our families.
Yeah.
And by the third year we were telling anybody that would listen.
It's a cool world out there, you know, if you can't have kids. We were at a wedding, and I remember that Stacey's sister-in-law was asking just routinely about how everything was going and with the IVF and everything. And it took me a while before I realised that I kind of twigged with me that she might be pregnant. I thought she was kind of testing the waters just about how she'd break the news. Like, they were very apprehensive about telling us. And they told us, and we were delighted, and we were so happy for them. We really were, and we hugged and we kissed and everything. And later on that evening, I remember, and I'll never forget it, we went out for a dance on the dance floor. And suddenly we just looked at each other and we were both crying. And we kind of, everybody else was happy, and it was real kind of like a surreal moment where it was just the two of us, and we could have been on the dance floor on our own at the time. And I remember we said to each other, look, we'll give each other the rest of the dance. We'll cry and we'll hug and nobody will notice. And then when the song is over, we'll clean ourselves up and we'll go back and everything will be fine. And we did. And we were delighted. Like, we were delighted for them, but we were sad as well. You all right? So, but yeah, you okay?
On the prenatal ward, Natasha has been induced because of her twins' reduced movements. By her side are Andrew and her mum Naomi, for whom it's a particularly intense time.
Well, I was a twin as well, and my sister, she passed away at birth. She was stillborn. And I called Natasha my rainbow baby because I was pregnant with twin boys, and I gave birth to them here at 6 months gone, and they were stillborn.
I was like in full-on labour, like I was about to have the babies in the ward, and the nurse had to rush me down in a wheelchair. Everything was happening so fast, like I didn't think I'd get to the ward in time, like. On the previous pregnancies, my mum was there both times. So when she was bringing the bags up, because it was so quick, she didn't have a chance to leave the room, so she was just there.
Christine is my name. I'm one of the midwives. They'll be looking after you. How are you? Good strong contractions there.
As labour is progressing so quickly, Natasha doesn't have time for an epidural.
As soon as we got into the room, she was like breathing through the gas, and she just started pointing down. And then the nurse lifted up the sheet, and then you can see the baby's head.
That's it. Your baby's first head is born. Everything is fine. You're doing fantastic. Okay, baby's coming now. That's it. That's it. Now. Hello. Now, here's your first little one. Did you know what you were having? A little girl. 1759. Congratulations.
Twin one was in a hurry to come, and that was a very straightforward normal delivery. The delivery of the first twin can be stressful on the second twin.
Natasha is scanned to see what position twin 2 is in.
Twin 2 is Fetal breech, which means that the feet are coming first.
With each contraction pushing twin 2 out feet first, every second counts to deliver the baby safely.
Is there anything you want? Or?
No.
You sure?
I can't have anything.
For Stacy, Jean and Allan, the road to fertility has been long and difficult. Over the last 3 years, they have had 2 failed IVF cycles. The third was possibly to be their last.
The first time our pregnancy test came back negative. And that was a hard day.
Yeah, we thought after getting through every other stage, we thought this was our time. Our luck was changing now that we'd the hard bit done.
Our second cycle, we didn't get the follicles far enough over the line, so we had to scrap that cycle. And then the third cycle,
my body was getting used to the medication, so they upped the dosage and make it higher and higher. And I was getting to a very high dosage where if my body wasn't reacting to this, it probably wouldn't react for future cycles. So we were worried about that part. So we kind of wrote this cycle off, saying, right, we'll go through the motions. It's not working. We're barely getting above the line.
Yeah, we got 3 eggs, and after the 5-day wait, we had 1 embryo. Give us a kick. 3 o'clock in the morning, I was woken up to a positive pregnancy test. You're meant to do it after 2 weeks. Stacy never waits the 2 weeks.
Very hard.
We cried and we hugged and we kissed and we were delighted. And I've never seen a happier pregnant woman in my life. Stacy was just so happy.
Yeah.
We got the call from the clinic to say that the bloods came back, and "you're very pregnant" was the word that she said.
Gonna miss it. I'm missing it already. But I still don't think I'm letting myself believe it until I have the baby there and everything is okay.
At last, after almost 5 years trying to conceive, it's time for Stacy, Jean and Allan to go to theatre for their baby's delivery.
Right, let's go meet this baby. I'm crying already.
Natasha's first twin was born within minutes of her arrival to delivery room 9. Her second baby is in breech position.
Now, Natasha, we're going to put your legs up in stirrups.
There was 2 very senior doctors there. The feet were extremely high, so the registrar had to internally examine Natasha to hold the feet in position.
Big push. That's it. Right down to your bottom. Hold it and push down. That's it.
Her foot slipped out of her hand, and I could literally feel her swim away, and then feel your one's hand just grab her leg. Then I'm like, oh my God, imagine feeling that in your stomach.
Big push. That's it. That's it. Come on, more. And one more.
And then
The contraction's gone. Contraction. Natasha, listen to me. I'm going to take the gas for a moment.
No, you're not.
And she was like, no, we need to take that back. I was like, you're not taking it anywhere.
We'd really like you to have another normal delivery, okay? So if you work with us, we'll have the baby really soon.
And when the contraction comes, Natasha, give a big push down.
Push down more.
Come on, right down.
No, not push it. Natasha, please remove that from your mouth. You have to.
Remove your hand from there, please. Get your hand away from me, please.
Natasha.
You did a bit of shouting, I did a bit of shouting. The poor midwives got the brunt of it, didn't they?
Please give me the gas for one moment.
No. Tasha, what, Mum?
Come on, you have to work with Natasha.
Now, give the gas.
No.
No?
No.
Do you want this baby out?
Natasha, you have to work with, please.
Have you got the traction? Push.
Yeah, okay,
Go for it, go for it. No, come on.
Your body's telling you what to do. So I was trying to listen to my body instead of trying to listen to everybody else.
That's it. Come on. That's it. That's it.
Push, she's
coming. That's it.
Very good.
That's it. Now, 18, 17. Now, your baby's foot is out, okay? You're doing great.
It's not an everyday occurrence, and when you see a baby being delivered by breech, there may be a delay with the head coming. It is a challenging situation.
That's it. Now, Natasha. That's it. Now, Natasha. 18, 18. Now she's just a little bit stunned because that one was a little bit hard on her, okay? So we're just going to bring her over to the baby doctor. Yes, it is a girl.
She's fine. She just, if it was just a bit more pressure. Like Andrew was looking over, he was holding Amelia. And I just went over to Andrew. I said, Andrew, she'll be fine. She'll be grand. My own heart was sinking as well, like, you know. And I'd gone over, I said, is she going to be okay? And he said, yeah, she's fine.
There she goes.
Yeah, all right. Come on. Are you your sister?
Hello, Missy. You got to open your eyes? I see one.
My mum started crying. Like, she never cried at the other births, so she just started sobbing. But I think it's because, like, obviously, like, she had twins before me and she lost them.
The twins will now be tested for cystic fibrosis. Natasha and Andrew will know the results in a few weeks.
The minute you have the baby, like, the pain goes, like, you can't remember. Like, even now, like, you still get the twins mixed up.
No.
And they don't even look like each other. Yeah, you do.
No, I don't get mixed up.
There you have it.
They look nothing alike. Like, one has, like, loads of hair. One has, like, not like a granddad hair.
Now, look down at them. That's what makes it all worthwhile now, doesn't it? All that pain.
Stacy, Jean and Allan are on their way to theatre. With Stacy's previous surgeries, a C-section is the safest method of delivery. The sense of expectation is building.
You all right? You sure? You want to back out? You keep it in there?
I walked that corridor 4 times beforehand for my operations. It was always the same, walking down the same corridor into the theatre.
Oh yeah, it could be my last one.
Yeah.
Touch now.
It is.
That's your back.
Do you know what you're having again? No, that's
surprise.
Right. Okay. Do you want me to show you?
Do you know what we're having?
No, no, you'll be the first to know nearly. You'll be the first.
Every operation was hope. Every operation I got done, it was like, right, this is going to fix everything. We'll get pregnant now. Do you know? So you always left there with hope. So it was, but you always walk down hearing other people delivering babies.
Yeah.
Here's all I guess I'll see you in there. Love you. See you in a minute.
No, can you just follow me?
All I want to do is just see the child's face and know that it's healthy and it's fine. I really don't. If it's a boy, I will be shocked. I really just don't. Whenever I think ahead of christenings and birthdays and Christmases and stuff, it's always a girl. And I just don't know why that is. I'm just fully convinced. So I will be very shocked if it's a boy. I love a boy as much as a girl. So once the child is healthy and happy, I don't care what sex it is, you know. You know, maybe it'll be gender neutral, who knows? That's okay too. I scrubbed up well, and Stacy was very happy that they were
the
Galway colours, that they were maroon scrubs.
And getting into the same room and seeing some of the staff and going, right, well, I've had her and her before. And I was like, this is good, this is a good omen.
Then me realising, oh my God, we're about to meet this child that we've tried for so many years to make.
You might feel a bit of a stretch. Yeah.
Okay. You're okay. You're out 3 minutes. Speak to it. Out 3 minutes. Okay.
Hello.
Congratulations.
And let's see what we got, guys. What do we got? It's we're right. You see her? Hi, my dog. Oh, she's not happy with me. I'm just going to let her relax down on your tummy for a minute.
Thank you.
Congratulations, both of you.
She looks perfect. I forgot to look and see what she was. I was just looking at her face. I was like, oh, it's a baby. It's a baby. We've heard her crying. She's the image of you.
Look at her, she's beautiful. I'm going to take her to the wall.
She's the image of you.
Feel nice and warm.
I don't remember a time without her. As soon as she was there, I was like, yeah, that's my baby girl.
It was worth it all, wasn't it? It was almost like you always knew her. Like that she was always someone that was always there, not someone that you met 3 minutes ago. She's beautiful. And suddenly you're just a father in a corridor with a baby, and you know, you're looking down and they're looking up at you and... Hi. Hi. You look at her and she smiles at you, and you know, you feed her, and it's just, we're so lucky. You know, we're so lucky. Yeah, it's just been unbelievable. Like, we took a photo of the two of us just after the embryo had been implanted into Stacy, and the fact, you know, like the thought that this baby has come from that is just unbelievable. The fact that Stacy grew this little girl inside of her, and you know, that pregnancy was just full of love, and it was full of, we loved every minute of the pregnancy. We loved it, you know, and we're going to love you even more. Yeah.